If you are thinking about getting a laser treatment, you are definitely going to want to listen to this first. Despite seeing lasers being advertised anywhere and everywhere, and it seems like just about anyone can buy one and fire one, what do you really need to know before getting that laser treatment? Spoiler alert, just because it looks like they're simple to use, there's actually a lot of science that goes into lasers, including physics, so that you are getting the best treatment for your skin. And it's not just about getting the right laser, it's having the right person holding that laser who knows what they're doing to give you optimal results and to keep you safe. I'm Dr. Mina. Welcome to the Skin Reel. On this week's episode, I am joined by Dr. Nicole Salame, who is a double board certified dermatologist and laser expert. She did a laser fellowship at one of the top programs in the country, and she has familiarity with all the lasers and cosmetic devices on the market. And she's going to be taking us on a deep dive into what you need to know to get a safe and appropriate laser treatment for your skin and for the condition you're trying to treat. Lasers can do phenomenal, amazing things, but in the wrong hands, complications can occur. If you are thinking about getting a laser device, listen up. Dr. Salame, I am so glad to see you again and to get to chat with you all about lasers. You truly are an expert in cosmetics and devices and lasers. So I am so thrilled to have you on. Thanks for being here.
I'm so glad to be here. Thanks for inviting me, Dr. Mina. This is really a full circle moment.
It really is. Yes. I met you first when you were a resident, and I was not that far out in my training. And now to see that you are this phenomenal dermatologist and practicing, it's really, really cool to see all that growth. So, congratulations.
Thank you so much. I'm glad to be here.
I know you did a special fellowship just in lasers and aesthetics, and that really is your area of expertise. And I think a lot of people get confused with lasers. Sometimes I think they think laser is just one thing out there, right? Like you either get a laser or you don't, but it's really much more nuanced than that. So, can you just let us know what are lasers exactly?
So, lasers are devices that focus on usually a specific wavelength of light. And the idea about lasers is they're very customizable. And you might be hearing when you look online or try to find a provider to do, something like a photofacial, for example, is not a laser. It's a broadband light, it's a flash lamp. So, lasers, unlike photofacials or IPL devices, are focused energy and collimated light. And so, the idea is that you have a focused target, a focus chromophore is what we call it. So a focused target that the laser targets. And this allows for many benefits. For example, if you have a laser that's a resurfacing laser, for example, you're targeting water, that allows you to resurface the skin. And then there are vascular lasers, which are very different from resurfacing lasers, which target hemoglobin. And this targets, vessels like broken blood vessels in the face, flushing, rosacea treatments. And then you have pigment lasers, which target browns in the skin. And those are very different too. Now, sometimes resurfacing lasers can help with pigment, but they're not very specific for pigment. So lasers are devices that are focused on one thing. And depending on the problem or the issue that you're hoping to treat, the laser expert can select the device tailored to your skin. And I tell my patients this all the time. The most important thing besides the treatment is really the cosmetic consult. That's really the time with you and the provider to discuss what your goals are and how to best achieve your goals. And the provider's job is to help you navigate the different options for you. And so it's really important that you go to a provider that has all the tools and has the training and the understanding of these devices, which are very complex. There's a lot of complexity and nuance to these devices. And that was a big part of my fellowship. I spent a whole year learning the nuances of these devices and how to safely use these really powerful machines in patients of all skin type to help them achieve their best skin. So going to a provider who knows their devices and understanding that these lasers are not just one size fits all is really important for patients.
There seems to be this misconception that lasers are really simple, right? And that, whatever program on the laser will tell you what to do. It will tell you the settings and a monkey could do it, right? You just like point and shoot and click, click, click with your handpiece. And that I think is dangerous. And that's where we see problems, right, as dermatologists, because people are getting these treatments done by people who think, oh, I just will let the computer program tell me what to do and I'll just fire it and everything's going to be perfect. But we know in the real world, that's not the case, right?
You just summarize it so well. I think that the biggest problem we have, that used to be that the entry level to using these devices were kind of the core specialties, that those who were trained in aesthetics part of their training. So dermatology, plastic surgeons, oculoplastics, ENT. Now it's become more acceptable and available for those with minimal training, mid levels, and sometimes even doctors who are outside these core specialties who feel empowered after attending a weekend course where, these laser companies, and I've been to these courses and it's kind of wild. You sit in the audience and you hear them discuss laser and physics, and they don't really discuss physics. It's very elementary and it's made to seem like it's so basic, but it's not. Laser physics, skin tissue, laser interaction, understanding your endpoints. We talk about endpoints and as laser experts all the time. Laser endpoints are what the tissue, the skin is going to do when you fire the laser and that target, that chromophore, takes up the laser energy appropriately. There's a reaction that the skin has that is very specific. And you're looking for that. And every time I fire a laser, I first fire away from the patient, then I fire on the patient. I do a test spot here and I watch. I watch for a few minutes. It doesn't matter how many times I've used that laser that day. I still look at the skin and I want to see, is this the right reaction? And there are danger signs. Importantly, another thing besides the endpoints, there are danger signs. And those are signs that something's going wrong. I need to do a safety check. I need to stop. I need to look and check everything on the device and make sure everything's okay. Is the patient's skin wiped off? Is the device appropriate? Is the wavelength appropriate? And the wild thing that I've seen, unfortunately, we see a lot of patients who have been burned by these devices by mid-levels. And not just one spot, like a whole area. And the idea is that this mid-level or this individual, not just mid-levels, but whoever fired this device, continued the treatment. There were probably obvious danger signs of blistering or dusky skin, and they felt like it was appropriate to continue the treatment. And that just shows the lack of understanding of skin laser interaction.
Yeah. And a lot of times the patients will say, gosh, this is hurting more than usual. I'm having a lot of pain. And you have to listen to that. You have to be cognizant of that. I love your point. Like, no matter how many times you've used a laser, things can change. It's not a perfect science. I mean, it's pretty phenomenal, amazing science, right? But things can change. Was the laser recently serviced, right? Is something malfunctioning? So you have to be attuned to that. And I'll say, unfortunately, these laser companies are marketing to people who are not in these core aesthetic specialties. They're marketing to doctors who have never used a laser before, maybe don't even see patients clinically, and to people with zero medical knowledge, right? And they're telling them, oh, you can make so much money. You can start this treatment, you can charge this, and you'll make so much money. And that's what they lead with, which I just find is crazy. And I'm on a mission, right? Like you are to just help people make good choices. And this is not the area you want to cut corners. You want to get a deal. You want to make sure you're seeing someone who really knows what they're doing, because I'll always say too, like, no one's immune from complications, right? And we all can get complications, but you can minimize complications when you know the safety parameters and you know the right patient selection and right laser for that patient. And when you know what to do when you see complications starting to rise, like you said, you're looking at the skin, you're assessing how the treatment is going, and then making changes as needed.
Exactly. And knowing how to manage your complications. We see these people, unfortunately, these patients hope to save money, which is, I understand. We're all trying to save money, right? But this is not where you skimp out, because you might be saving a couple hundred, but you might pay for it, you know, and a lifetime of scarring and very expensive laser treatments to improve scarring. Scarring is permanent, right? It's difficult. You can't really eliminate scarring. So I tell my patients all the time that it's kind of like a scalpel, right? In the wrong hands, a scalpel is a weapon. In the right hands, it's a tool. And you have to make sure you're going to someone who has the right training and will use that device on you appropriately. And if there is a complication, right, like you said, we're not immune from complications. Things can happen. Knowing how to manage it and being at the patient's side. These patients unfortunately do show up in the clinic being referred from these spas that don't know what to do next. And that's scary.
I don't know if you get this too, but I will get text from people I know and someone they know. So it's like third degree of separation or more. So that are texting saying, oh no, this person is the director of a med spa and one of their practitioners has this complication. What do I do? And I just think that's just crazy, right? You're having to text a friend to text a friend to text a friend to figure out what to do. So you don't want to be in that situation if you're getting a laser treatment. You're getting the laser treatment because you want to improve on something and get better. So I get people telling me, like, well, how do I know? Right? Like, what would you advise? Because it is hard to know, right? And someone may say, oh, I do this all the time. And they maybe do it all the time. But how do you know who is going to be good at a laser or not?
Yeah, so that's a really good question, and I wanted to also mention another problem that we're having in our society besides mid-levels or people who are not trained extensively in these devices, picking up the devices, is that sometimes there's kind of a level of deceptive marketing where the patient goes into the room and sees a individual wearing a white coat who might introduce themselves as a doctor, and whether their training merits that title is not really the conversation. It's not really the problem. The problem is that there's this inherent deception to the patient. I've had a lot of patients be like, I don't know if I saw a doctor. I don't know if I saw who I saw. And it turns out to be like a nurse practitioner or optometrist, who's calling themselves a doctor wearing a white coat. Many people wear a white coat. So who is who? And the best thing you can do to protect yourself is really ask about credentials. Ask where they went to, where they trained, what they did. You can go online. People who've had extensive training put their credentials online. They're proud of it. They've worked hard for it. And if you can't find those credentials, if you can't find that information, that should raise a red flag, right? If there's a level of deception here. And then also demand that in yourself, demand in yourself that your skin be treated by someone who has the training in cosmetics, who has a fellowship training. Fellowship trained dermatologists are the leaders really in this field. So going to those people will safeguard you from future complications.
That's right. To me, they're my patients, right? For a lot of these places, they're clients or customers, right? And unfortunately, it requires a lot of due diligence on the person seeking out the treatment. And yeah, the term doctor nowadays is just so it can mean anything, right? It can mean a doctorate of English literature, which is wonderful, right? But it could mean so many different things. So simply just saying doctor or even board certified physician, that to me, when I see board certified physician doing cosmetics, it lets me know they're not a dermatologist, plastic surgeon, oculoplastics, or ENT, right? Because they're not sharing what they're board certified in, right? And so that's a red flag. And it's sad that there is this deception and that you really do have to dig through it to make sure you're seeing someone qualified. But unfortunately, that's where we are. At least in Georgia, you are required to put your credentials after your name. And so you can't just say Dr. So and so. You actually have to say your name, MD, or your name, DNP, or whatever you are. But again, that's also expecting the patients, consumers, clients to know what those initials mean, which is confusing too. So it is tricky, but it does require some due diligence to really see someone trained and qualified. So thanks for bringing all that up. What about lasers for people with all skin types? Because I hear this a lot. People with darker skin are worried about getting laser treatments, or they know someone who's had a complication with laser treatments. Is it safe for people of all skin types to get laser treatments?
Yes, yes. I hear this all the time. I have patients who come in with acne scarring who are darker skin and they say, oh, I can't get laser because I'm darker skin. I'm like, no, you can get laser. You just have to get the right laser. So that's also the nuance, right? And going to someone who knows, again, going to someone who knows their devices and can tailor the device to your skin type. So these devices are powerful and they're customizable. There's a lot of new devices that are on the market, like you had mentioned, that are kind of meant to be plug and go. And to be honest, those are very dangerous because you don't really understand exactly what's going on in the device. You don't know the wavelength. You can't wear the right safety goggles if you don't know the wavelength. There's a lot of problems with that. But the older devices, or not the older devices, but the devices that are commonly used by like board certified plastics, those can be customized, right? So there are devices that are also now made inherently for all skin types. They're said for all skin types. So really, they're specifically beneficial for darker skin types. And lighter skin types, you can push a lot of our devices. And because there's not a pigment problem or there's not too much in the skin comparatively, you can really push those devices in those patients. With these other devices, some of them being like Pico lasers, something I use in clinic, you can really use these devices for those patients. Basically, the energy that's delivered to the skin is delivered in fractionated pulses. And in layman's terms, that means that you're getting short bursts of energies, picosecond, which is way smaller than a millisecond doses of energy. So it's safe. You're not exposing the skin to heat for such a long duration. So your risk of burns and of a pigment is reduced. So those are my favorite. Picosecond lasers, something I use for all my patients with darker skin types. But unfortunately, I have to have the conversation that we can use these devices, but it's going to be a slow and steady thing. You might not get that one treatment to push you kind of to 40% of your goal. We have to take it slow. We have to see how your skin's doing because I want to get you there safely. And a lot of my patients, do very well with the picosecond laser. Other lasers, another common issue is use of IPL. So Dr. Matt Avram at Harvard MGH did a study looking at all the litigated cases for laser surgeons, and not laser surgeons, but people who use lasers, laser operators, really. And the number one litigated case was intense pulse light in darker skin. So you should never be using intense pulse light laser in darker skin. It's very risky. It's not a laser. It's not specific, right?
I can't tell you how many cases I've been asked to review with exactly that, and I can't defend it. I can't defend using the IPL laser in darker skin.
Just right off the gate, wrong laser, wrong skin type. Right off the gate, this is a horrible decision. But there are lasers that are safe for laser hair removal in darker skin and can have huge impact on medical issues too, not just cosmetic, right? Like ingrown hairs and things like that. So there are lasers that can be used specifically in darker skin types. And then there are lasers that we use in lighter skin types that can be customized to be safe in darker skin. For example, I have a Fraxel Dual or resurfacing laser. I can customize it to deliver lower energy, lower density, which will be safe for all skin types. And I do that often for my darker skin type. So you just have to go to the right person and your skin can be treated with a laser.
Exactly. It's more like the right settings and the right laser, the right wavelength. Not everything is going to be appropriate. And again, it may take a few more treatments, but better safe, right? And a few extra treatments than to try to blast it all at once and then have some complications that could be permanent.
Yes. And you can also combine lasers with other things. I do this all the time. I combine lasers with chemical peeling, basically combining other modalities that don't introduce extra heat but can get us there. So, chemical peeling, micropeeling, and a picosecond laser is one of my favorite combinations.
Let's talk about some of the cool things that lasers are being used for now, which I do a lot of skin cancer surgery. And I just on Friday had a patient asking me about using a laser to treat his skin cancer. So is this something we're going to start seeing more and more of, lasers to treat medical things like skin cancers?
Yes, it's a beautiful idea, right? A lot of our patients, especially I work in Manhattan Beach and Los Angeles on the beach. I have so many patients with just every time I see them, there's a skin cancer surfers, beachgoers. And, there's a lot of surgical fatigue. And I mean, I don't blame them, right? It's a lot to go through. And there are lasers, there are many pilot studies that have looked at using different lasers for skin cancer. The first kind of subset would be ablative lasers. So using a laser that physically destroys the skin. And the idea is kind of similar to the scrape and burn, right? The EDNC, where you're scraping the skin, burning the skin. It's basically just local destruction. And obviously, the cure rate is going to be a little bit lower than if you were to remove it with Mohs surgery, obviously, or excision, where you're checking the pathology, making sure you get the whole skin cancer out. But the idea is for those patients who have low risk skin cancers, don't want to undergo another surgery, and understand that this is experimental. It's kind of mentioned even peripherally in the NCCN guidelines. It's not a first line treatment. If they understand that and that's documented and that's understood, and you're checking that skin for a recurrence at that site, I think it could be an option for a patient. A more elegant way of treating these skin cancers with lasers is to use vascular lasers. And I think this is kind of the future, using things like the Nd:YAG or the pulse laser, the VV. And these are vascular lasers to target the vessels that supply the skin cancer. So you're kind of suffocating the skin cancer in a way, and it's less destructive to the skin. So there's less of a scar there. It can effectively treat the skin cancer. But, obviously the cure rates will not be comparable. But I think the idea is excellent. And maybe in the future, do I offer this as first line to my patients? No. But maybe in that elderly patient who really doesn't want to keep going through procedures. And then also the idea that this is not going to be covered by insurance. Obviously, this is another important discussion with the patient is that their insurance will not cover this. So there will be an added cost for them, unfortunately.
Yeah, no, I think it's amazing. I remember when they were doing these sort of early studies back during my residency, and the fact that you could treat a small basal cell on an arm or the trunk with a one time treatment with a 1064 nanometer laser, I think is amazing. And I know if I had a skin cancer in those locations, I would love to try that first, right? But great points that you brought up again. It's newer, it's still, I wouldn't say experimental because we do have studies showing that it works, but cure rate isn't quite as high. But I think in the right patient, in the right skin cancer, it could be amazing. And yeah, unfortunately, I don't see insurance covering this, but that is a hurdle for people as well. But I think it's a great option. I always love that we have more options than just having to do Mohs surgery or cut things out all the time. Because, yeah, patients, they do get tired of that. It can be just mentally and emotionally and physically exhausting for them. I think this is really cool too. I get this question all the time from my older patients where they say, oh, the damage is done. The sun damage is done. There's nothing I can do. They feel like there's nothing they can do. Are there any lasers that can help prevent skin cancers or help prevent some of that pre-cancer damage for someone?
This is where I get very excited. I use this all the time in practice. Using these laser resurfacing devices to treat precancers and prevent skin cancers. So I see a lot of patients medically for skin checks, and a lot of them have precancers, right? We call them actinic keratoses or precancers. Those are the things that are typically burned off with liquid nitrogen at your skin checks. And if you have many of them on the face, your options are usually kind of field treatment, is what we say. And one of those field treatment options that's FDA cleared is non-ablative fractional lasers and ablative fractional lasers. Fractional. So the idea is using this resurfacing device to treat the whole face and not only treat the precancers, but any subclinical skin cancers and allow kind of resetting of the skin, rejuvenation of the skin. And I tell my patients this has many benefits. It will rejuvenate your skin. You'll have less brown spots. It'll look nicer, but your precancers will be treated. And any subclinical cancers, basically skin cancers or precancers that I can't even see with my own eyes, will be targeted. And it prevents skin cancers. It basically triggers this, what we call immune surveillance. Energy lasers light into the skin, stimulates heat shock proteins that kind of call in inflammatory cells. And in your immune system, the job of your immune system is not to only protect you against infection, but also cancer. So when they're calling in, the guards to check in this on the skin, you're also seeing any precancers in the way, like, oh, let me take care of this at the same time. So the idea is that there's an immune surveillance response. So there's many benefits. And a lot of my patients get both this treatment maybe once or twice a year, in the fall and the spring. And it's really reduced their incidence of skin cancer. They love it. So definitely something I recommend to my patients, especially the beachgoers.
Oh, yeah. It's a great option. And I would say some of the downsides, right, are that not covered by insurance. But I recommend it for my patients. They're already asking me about some cosmetic things or how do I make my skin look better. They also have a history of skin cancer and some precancers. They sort of want that cosmetic boost and benefit, anyways. And so it tackles both things, the cosmetic and the medical issues that they're struggling with. So it's a great option. For some listeners, you may have been to your dermatologist and they freeze little spots on your skin with what we call liquid nitrogen. And I tell people that's kind of playing whack-a-mole, right? You have to wait for the rough spot, the precancer to develop, and then we freeze it. It gets red and crusty and flakes off, which is a totally fine option. But even better would be treating before we can see and feel these precancers, right? And that's where the laser does beautifully with that. So it's a great option. How would you advise someone who is maybe interested in getting laser treatment, or they're not really sure? Maybe they have some precancers, but they also want their skin to look better. What do you advise someone? Maybe they're in their like 40s, 50s, and they're interested in getting started with some laser treatments. What would you recommend for them?
I mean, the first thing you should do is go see your board certified dermatologist who has all the devices, right? I commonly see patients now, 30s, 40s, who are coming in saying, "Oh, I saw that you do cosmetics and you take my insurance. Can you help me? I don't even know what I need. Can you just help me? These are my goals." And these are the patients that I see, yearly for skin exams, making sure, I treat their rashes, I treat their kids, I treat their husbands, whatever. But then also we start talking kind of parallel. How can I improve your skin quality too? Or great, now I treated another example. Now I treated your acne, I've cleared your acne. How can I treat your acne scars? Unfortunately, with insurance coverage, and a lot of patients don't really understand this. And to be honest, it's not really obvious, right? Where the border between medical and cosmetic is. For example, acne, right? Active acne is covered by insurance. I can clear your skin, but if you have post-inflammatory hyperpigmentation, or basically the brown spots that are left behind from the acne, that treatment is not covered by your insurance, unfortunately. But it is part of the spectrum of acne, right? And so is the scarring, which can have an impact on quality of life. And I would argue is medically necessary to treat, but that's not covered by your insurance. So I might start with the patient treating their acne, or take a look at their skin during their skin cancer treatments. But then we might transition to saying, okay, let's do a Fraxel to clean up your skin. Let's do some acne lasers to improve the texture and the scarring on your face. So going to someone who does both is if you want to tackle both, or in a practice where one person does one thing and there's an internal referral resource for the cosmetic person. It's nice to get your treatment done kind of in one place because that provider knows you on so many levels.
That's what I love about dermatology, right? It's the relationship that you have with a person where you can help them with medical issues, a rash, skin cancer checks, but then you can also help them with any aesthetic goals that they have, or just keeping their skin healthy, their complexion beautiful. And I really find you get the best results when you see one person and you're not looking for quick fixes, right? And you sort of have a long term vision plan or goals. I find that if you're shopping around, you're going here for this thing and here for that, it can look really piecemeal and start to look kind of funky and unnatural. So I'm all for have one person. It's kind of like my relationship with my hairstylist, right? Like we have this like long-term relationship and she knows what I like, what I don't like. She offers, oh, my hair is maybe getting needs it's time for this or that versus shopping around for a different person each time. I don't think I'd get the best results. So I do find, and maybe I'm biased because I am a dermatologist, but seeing someone who can really tackle the medical and the cosmetic and sort of follow you long term, I think leads to such great results. And it is confusing in our field, stuff we think should be covered, right? Like preventing skin cancers with a fractionated laser should be covered, but insurance doesn't see it that way. So the line between what is covered, what isn't, can be really blurred. Again, I find if you have that one person, that sort of quarterback for your skin, you get really beautiful natural results for your lifetime.
Yes, I agree. It kind of feels like you're the safeguard, or like the person who's in charge of their skin on many levels, and it's a privilege. It's so rewarding to be able to treat patients and multiple levels, help them get all their skin goals achieved, and then kind of through every stage of life and even their children. It's just rewarding to be that person, that point. And a lot of patients, especially where I practice, they like having their one doctor. They like having their one person to go to. That relationship is so important.
Totally agree. And a kind of a segue, but I'm in my mid 40s now. And I find that this is an age where, especially as women, we're feeling like, what is going on with my skin? They're feeling discouraged. And there's just so much noise and nonsense out there that it's also nice to have one person who is really looking at you holistically, your skin health holistically, who can help guide you. Like, do you really need to buy that? Is snail mucin or flaxseed oil really going to replace Botox? They can help set you straight on where to invest and what's really just garbage and you don't need to worry about.
Exactly. The idea of de-influencing, right? There's so much noise online. And having that one person who has your back. I always tell my patients, I have your back. And my job is to protect you from being overfilled with filler, from burning your skin, from getting skin cancer, and from getting stuck in these, TikTok trends that can hurt your pocket, right? And be a waste of time, which is a commodity as well. So I just have your back.
Yeah, a de-influencer. I love it. Because it seems like there are a lot of skinfluencers out there, but not necessarily with the expertise to hold that title, right? So yeah, de-influencing.
But I hear it all the time and I love it. De-influencing. We need more of that.
Yeah, for sure. I love that. What is sort of the future of lasers? Are you familiar or have any experience with some of these newer lasers, like the one for acne, or I think it's a device for hair loss? And if you don't want to answer that, what is sort of the future with lasers in skincare?
Yeah. So that's a really great question. I am not paid by any of these companies. I won't mention, I guess, the name of the companies, but there is a device that I use in practice that uses ultrasound to deliver a proprietary growth serum into the scalp. And the growth serum has a lot of peptides and growth factors. And when I first heard about this, and the idea is like a needleless delivery. You don't need PRP, you don't need to inject the scalp. A lot of patients find therapy painful. And I ended up using this on my sister, who has been struggling with hair loss for years, has been maximized on medical treatments. And she grew her hair in 6 months. She was at a plateau and it was miraculous. And so I became a believer in this technology.
So I got to know the name,
It's called Almated
and it uses ultrasound.
ultrasound. And the idea is that ultrasound creates kind of a shock wave effect that disperses the top layer of the skin. And so everything in lasers, really, if you really want to dumb it down, which I don't recommend you do, but if you really want to keep it simple, is controlled destruction of the skin. And this is in aesthetic dermatology in general and is the future of our field is how can we improve delivery of things to the skin? Because our skin is our protector and it's very good at keeping things out, but it's also very hard, right? Then to get things in. Well, if you want to bring things into the skin, right? So a lot of skincare brands that I worked with are using these really innovative topical delivery systems to introduce growth factors. And these are regenerative, we call them regenerative biologics, things that are kind of results or a downstream effect of stem cells. And what if you can deliver that into the skin and prevent aging, right? That's really the future of our field is people are hearing the talk of senescence, and senescence are basically dead, what we call like zombie cells, cells that are no longer dividing, but are still active metabolically and turn other cells around them into these senescent kind of deadish cells, right? And what if we can prevent those from happening, turn back the clock on the ones that have happened, or prevent them from turning these other cells into that? So really the future is how can we get things delivered into the skin topically? And that's outside of lasers because typically lasers in the past have been used to help deliver things in the skin. You poke holes into the skin and then you put a topical on top, hoping that it'll improve delivery. So that's kind of the future of regenerative dermatology in our field. And lasers already are kind of part of that conversation. Lasers do regenerate the skin. And there's a whole thing online, and I have to say this, saying that lasers thin the skin. And I think that's crazy. It's actually the opposite. That is the definition of misinformation. Lasers do the opposite for your skin.
Yeah. It's like opposite day.
I know. I'm just like, what? How? Who said? I just want to find the person who started this. And it's interesting. Misinformation spreads way better than the real information.
I think lasers are so cool, but it is regenerative medicine, right? Like we can do a laser treatment and boost collagen, right? There's questions of do collagen supplements work and all that. But, it's like, I'll tell you what will boost your collagen on your face is if we do a laser treatment, right? A resurfacing treatment, 100% we can boost that collagen. So it's thickening the skin, it's thickening your dermis. Your skin thins with age. I mean, trust me, I see it under the microscope every single day, right? When I'm stitching skin on areas that have chronic sun exposure, I can see it, I can feel it. So lasers will actually boost collagen. Again, the right laser, right? If you're using a resurfacing laser can boost it. So it definitely does not thin the skin. And I'm totally with you on regeneration being sort of the future of skin health, and how getting drug delivery, getting medications or topicals into the skin is so key because you don't want to spend hundreds of dollars on growth factors or peptides or exosomes that can't penetrate your skin barrier. Because then you're just paying for a very expensive moisturizer, right?
Hyaluronic acid is all the buzz, right? Hyaluronic acid is a very big molecule. It does not penetrate the skin. And maybe you'll feel like your skin is supple and soft, and that's because it's sitting on the top of your skin. And they've looked at it. It's sitting, right? They stain the skin, they look at it with fluorescent, like microscopy, and they see that it's sitting on the top of the skin. But what if we can deliver it into the skin? And what if what we can deliver can turn back the clock? And this is not really lasers. This is more regenerative skincare. But I think lasers have really opened up this, it was kind of our entry into regenerative dermatology. And I think there will always be a role with lasers. And really, the future of lasers is how can we treat patients and minimize downtime. Everyone wants that one treatment and not walk away looking like they've been, through it. Unfortunately, I tell my patients, you got to pay. There's always a payment. Beauty is payment, right? You have to have the downtime. So the more aggressive I get with you, the more your results, the more your downtime. Unfortunately, it's a catch, 21. You're never going to win. So really, if we could find a way to reduce the downtime for patients, there's a new device also that has come out that has been all the buzz. It's called the Myria device. Have you heard of that?
Yeah, I've actually had it, tested it out on myself.
Burns a little bit, but I've used it on myself too. And it's my colleagues in New York who use it love it. And the idea is that you can get deeper into the skin with reduced downtime because you're sparing part of the top layer. The skin is a cone-shaped beam. So just kind of we know that fractional lasers are kind of will rejuvenate the skin, maybe playing around with that technology that came out of Harvard that has been so, such a game changer in our field to innovate that to reduce downtime.
Amazing. So many cool things. I always love going to our conferences, especially the laser ones where we really dive deep into this, all the amazing stuff coming out. And also just like learning, I think sometimes people think, oh, you always need to get like a new laser, a new this, a new that. But like you mentioned earlier, these classic lasers, these classic wavelengths, you can do phenomenal things, especially if you know how to tweak them for the patient and for the right indication. You can get beautiful, beautiful results. So don't just rely on the computer programs, what they spit out to tell you to do. Like that's just like basic level. See someone who really understands the device and knows how to tweak it to give you the best results. Dr. Salame, thank you so much for being here. This has been a lot of fun. I've learned a ton. I know people are going to want to follow you. You have amazing stuff on Instagram, and maybe they want to come see you in person. Where can they do that?
Yeah, so you can find me on Instagram at Dr. Nicole Salame. My last name is spelled Salame. It's not salami, but I'll take that. So you can find me at dr.nicolesalame.com on Instagram, on TikTok, and on X. You can also find my website is www.drnicolesalame.com. I practice currently in Manhattan Beach, California at OSVI Dermatology and Surgery Institute. I will be practicing starting in July in Palos Verdes, California as well. So come see me. I'd love to see you and I'd love to take care of your skin.
Amazing. Well, I will include all that in the show notes so people can find you and follow you. Can you just give us like your top 3 takeaways for someone interested in lasers, what they should be aware of with your expertise as a laser expert?
Just the number one, go to the right person. Demand the right person for your skin because this is the only skin you got and a lot of things can go wrong. So the right credentials, the right person with the right devices. Trust your board certified dermatologist. They are here to take care of you and they have your back and to protect your skin and take care of all elements of your skin health. And then that the future is bright. I think the future is so bright in our field. And I mean, the future is going to show that we can maybe even turn back the clock on the skin. So just stay tuned.
I love it. Well, thank you so much, and I will see you next week.